Maybe it's mine. T, I can't hear you. Maybe is it my computer? Can you hear me? You can't hear me? Okay, give me 1 second. You can? Let's see. Hey guys, if you're here, can you write in the chat if you can hear either one of us? Okay. T, they still can't hear you. Hi, everybody. Give T a few minutes. She's going to go out and try to come back in and see if we can hear her. How y'all doing? Can you guys still hear me?
Okay.
There we go.
Better? Oh, the ghetto. Sorry about
telling you, this technology is something different.
And this is new for myself and as well as the channel. And so, yeah, like I said before, this is the first nurse trivia of the year. And I'm so excited because the last time I did this with you guys, I really did enjoy this. So, but the new thing about this live today is that I have a special co-host who's also a nurse and a YouTuber as well. So I'm gonna turn it over to her so she can give a short introduction about herself.
Hey everybody, welcome to our Nurse Tuesday Trivia or Trivia Tuesday. I'm Shay. I do know some of you guys in the chat. Hello. If any of you guys don't know me, I am a registered nurse. I graduated in 17 and I also have a YouTube channel. So I will leave my Instagram tag in the chat. If any of you guys want to go over to my Instagram, you can be directly linked to my YouTube channel. And on YouTube, I'm simply Shay, BSNRN. But basically, I just take you guys through nursing, beauty, and I'm also working on my NP journey as well. So I just want to thank T for inviting me to come on with her today. This is a good idea, and I think it's a good way to not only network, but some of you guys might be on break from school. Some of you might need to brush up on some nursing, questions. So I think this is perfect.
Yes, and so yeah, guys, don't forget to go and check out her channel. She has a lot to offer over there. So much fun. So we're gonna get started for the nurse trivia game. So basically, from the last live when we did this, I only wanted people who I don't want everybody to. I didn't want everybody to answer the questions until they've already won something. So this time, it's just like fair game. If you know, you know, and we're gonna be taking score. So we're gonna get started here. Shay, you ready?
Yep, I'm ready.
Okay. So this is the first question. So the nurse via NG2. The nurse should take which action when caring for the client to maintain client safety? Okay, I'm going to read out the options to y'all. So A, keep the client in supine position. B, change the NG tube with every other feeding. C, check for tube placement and residual at least every 4 hours. D, increase the rate of the feeding if the infusion falls behind schedule.
You guys can answer in the chat.
And I'll
go, y'all.
Okay.
Oh, there we go. There we go.
Look at them nurses, girl. Yes. It sounds cloudy, Sasha. But yes, the answer is C. All right, so we're gonna go forward with the next question.
Okay, can you guys hear me? Y'all ready? All right. So the nurse comes in to receive report on her 4-patient assignment. When beginning his or her rounds, which patient should the nurse see first? So should she see a patient that asked for apple juice in a sandwich? B, a patient on oxygen that had difficulty breathing during the previous shift? C, a post-op patient preparing for discharge? Or D, a patient who has daily foot wound dressing changes? Which patient should you see first? Oh, y'all. There we go. Okay. I see B's across the board. A patient on oxygen that has difficulty breathing the previous shift. So that's good. And the first one, I think, is Jasmine B. So she'll go ahead and get that point.
Okay, before we get into the next one, y'all, does it still sound muffled?
Yeah, T, you got a little background noise.
Let's see. How about now?
That's really good. Yeah.
That's better?
Mm-hmm.
Okay. Like you said, girl, this technology. Okay, so this is the next question. Let me see. All right. The nurse is caring for a hospitalized child with diagnosis of measles. In preparing to care for the child, which supplies should the nurse bring to the child's room to prevent transmission of this virus? So here are the options. A, gown and gloves. B, goggles and gloves. C, check for the tube. Check for the tube placement. Lord. C, mask, gown, and gloves. And D, gown, gloves, and goggles. So I'm going to say it again. A, gown and gloves. B, goggles and gloves. C, mask, gown, and gloves. Or D, gown, gloves, and goggles. Shonda is on it. I think that's who said it first.
Okay. Oh, y'all is fast.
They are fast.
Yeah, I think Shonda got that one. Yep.
You got that, Shay?
Yep, I got it.
Okay. Are y'all ready to move on to the next one?
I got a question for y'all. Can y'all see when I type in the chat or no?
I'm not seeing anything from you.
You said, are y'all not seeing my comment? Let me scroll up and see. What did you comment? No, y'all can't see my comments either. Oh, they just trying to kick me out the live. All right, that's okay. We'll go ahead and we'll move on to the next question.
Okay, I'm trying to figure out if it was something on my end that was preventing that from happening, but I guess not. No. Okay, so the next question.
All right. So the nurse assesses a patient with a diagnosis of psoriasis. How would he or she document the skin assessment? So A, the skin is oily. B, the skin has reddish purple spots. C, the skin has silvery white scaly patches. Or D, the patient has dry, flaky, brittle nails. How would you document a diagnosis of psoriasis?
This was a good one because when you first asked me, I was like, I don't know. I definitely got that one wrong.
So these are one of those NCLEX questions with those keywords.
Yes.
Oh yeah, and y'all, here y'all go. So I see Brittany English as the first one. Do you see that too, T?
No, not yet.
Y'all is lit though in this chat.
Yes.
These
I
answers
know
are
they're coming in
good.
so fast with it. So
Yeesh, it took me a minute to answer my own question. Okay, yep, that's C. The skin has silvery white scaly patches. So keywords for NCLEX. All right.
y'all, we about to take it over to one of these nursing riddles. These are so much fun trying to come up with. Now, I can't go anywhere and find nursing riddles. So me and Shay actually come up with these riddles on our own, okay? But y'all did really good the last. Huh?
I said they can't be judging us. They're
I know.
funny, but you cannot find these riddles, y'all. When T first told me that, I said, "Oh, I'm gonna Google. I'm gonna find me a good old riddle." No, nowhere.
Nowhere. And it's just so funny because it's like a whole rapping game, and you're just like, hold on, wait.
Oh, did we lose T?
No, I'm there. Okay, so I'm gonna put the riddle up, okay?
All right.
And y'all try to figure out what this is. I detect measurements in many routes. I have a sensor, but I cannot sense smells. I'm usually used to assess you. What am I? Jasmine said she did not come to play. Yes, Jasmine. In chat, it is thermometer.
Good job, y'all, because these are hard. I'm not gonna lie. We were giving each other riddles, and we're like, "Hold on, what is it?" All right.
Okay, we're gonna go on with the next question. Okay, so the nurse prepares to bathe and change the bed linens of a client with localized herpes zoster. The lesions are open and draining. Hold on.
Dang, somebody answered and you didn't even get to the.
No.
Whoa! Who is Baby Doll? Y'all is too much. I'm like, T didn't even get to the option yet. All right, T, go through the options just so they know, because you might be answering it. You don't know what.
Right, because this one was tricky for me because the lesions were open and they're draining. So the options were A, contact, B, droplet, C, airborne, and D, standard. And I could see why somebody would have thought, even though that our chat, they're really smart people, so they already knew, no, this is contact. But I could have seen why someone would have chosen to say droplet because of the draining. So, yeah.
I'm like, sheesh, I had to double take. I'm like, wait, did she
I'm
go through
trying
the answers? Is my computer slow?
at the same time. Okay, so we're gonna go to another riddle.
All right, y'all. So can y'all hear me? This riddle says, I am electric yet painless. I can let you know when there is a problem or when things are too fast or too slow. You may need to shave before me. What am I? What am I? Let me see before I give keywords.
They like, hold on, let me look at this a little bit longer.
Electric yet painless. Oh, I see. I
What's
see.
that? Is it Monty?
So I got
No.
Brittany English, telemetry dash
Okay.
EKG. Yup, EKG.
Okay, yeah, I see hers first. Okay, yeah, definitely.
Right. The thing that goes with the heart. I like
That's funny.
that.
Okay, y'all, moving on to the next question. The thing that goes on the heart. The preoperative client expresses anxiety. Which statement by the nurse is most appropriate at this time? All right, y'all, here are the options. A, let me tell you what this surgery is all about. B, it is normal for you to feel nervous before surgery. C, what have you been told so far about your surgery and which parts make you nervous? D, your surgeon will explain the entire surgical procedure to you beforehand. So don't worry.
What would y'all tell y'all patient that's has anxiety?
Do you want to A, let me tell you what this surgery is all about? B, it is normal for you to feel nervous before surgery. I see answers coming in. C, what have you been told so far about your surgery and which parts make you nervous? D, your surgeon will explain the entire surgical procedure to you beforehand, so don't worry. Let's see. So, yes, the answer is C. What have you been told so far about the surgery and which parts make you nervous? Because, again, you never want to predict something for the patient or tell them to not feel worried or it's okay, because honestly, we don't know how the turnout might be, and you don't want to tell them something and then later they're looking at you like, you told me everything was going to be fine. So, yes, the answer is C.
Yep. So this one is big on therapeutic communication and also your role as a nurse.
Yes.
You can't predict how a procedure will be. So, like T said, all right. Who said I'll tell them to get a grip and go on in there? That's me as a nurse, y'all. Don't do what Shay does.
It definitely is normal to be anxious, and as a nurse, you do want your patient. You want to make them feel comfortable, but that's just one of those things that we can't. Of course, we want to make them, help them to calm down and to feel comfortable before going into the surgery. But in class, they're gonna teach you to, I don't know, just like straight face. You can't say certain things.
And the biggest thing too, the nursing process. So assessment would ask the patient what they know first. So I know it's a tricky question because I got it wrong too, but I think that's the direction that one's going in.
Yeah. Okay, y'all. Who got that one? I don't think I caught it.
Let's see. I want to say Brittany again.
Okay. Okay, so we're gonna go to the next one.
All right, guys. So tell me which patient is most at risk for dehydration. So A, a patient that has asthma. B, a patient who goes to the gym twice a week. C, a patient with an ileostomy. Or D, a patient with heart failure. Which patient is most at risk for dehydration? Come on, y'all. Where my nursing students? Where my nurses? Dehydration. Oh, this one's hard. I see some answers, but I don't see the answer I'm looking for yet. Y'all need me to repeat them?
Yeah, Shay.
So, keyword dehydration. A patient with asthma. B, a patient that goes to the gym twice a week. C, a patient with an ileostomy. Or D, a patient with heart failure. And I think I see an answer in here. Okay, Brittany got it. So the answer for this one is C, guys, and it's the ileostomy. I know it's a tough one. Heart failure, as soon as you hear heart failure, think overload. So they have too much fluid. Let me see what the other, okay. Yeah, so dehydration, ileostomy, they're losing fluid. I know that was a tricky one.
So you said it was Brittany that got that one?
Yep, I see Brittany.
Brittany was ready for this live. I saw her comment.
Oh, this girl, she was ready.
Okay, so we're gonna go on with the next one. All right, during preparation of during preparation of a piggyback IV infusion, the nurse contaminates the IV tubing, which is the most appropriate action by the nurse to take. So, we want to think what's the first thing that's the best, clean, sanitary way for us to do, okay? So, A, complete an incident report. B, wipe the tubing with alcohol. 3, wipe tubing with betadine. Or D, discard the contaminated tubing and obtain a new IV tubing.
So think safety, think clean, protecting your patient.
A, complete an incident report. B, wipe the tubing with alcohol. C, wipe the tubing with betadine. Or D, discard the contaminated tubing and obtain a new IV tubing.
I see answers. So go ahead, T. Tell them what the correct one is.
Okay. So it's D. You want to discard the contaminated tubing and get a new one.
So that one goes to Must Be Sunshine. Get a new one.
He said, get a new one.
New one.
All right. Okay, so on with our next question.
All right. So our next question, guys, is your patient is put on a clear liquid diet in preparation for a colonoscopy. The patient can have all items except A, beef broth, B, coffee, C, vanilla pudding, and D, ginger ale soda. The patient can have all items except. What y'all gonna give y'all patient prepping for a colonoscopy? Okay, I see answers. So the correct answer is the vanilla pudding. Sometimes people will get confused with the beef broth and the coffee, guys. Even though it's darker, it's still clear. You can still see through it. I always used to tell people if you can hold something up to a white piece of paper and see through it, it's clear liquids.
You said the right answer was what?
So the right answer was vanilla pudding. You cannot give a patient vanilla pudding in preparation for a colonoscopy.
Oh, yeah. Okay.
And I think I seen, let me just make sure. I think Jasmine had that one too. Y'all be
Jasmine on it tonight.
All right.
Okay, moving on. Y'all ready? All right. The nurse is caring for an older client who has been prescribed Buspar. Which nursing intervention included in the plan of care should the priority to ensure safety? All right. So the options are A, document client reports of drowsiness. B, maintain the bed in the lowest position. C, instruct the client in the use of the call light. D, report client response to the medication to the healthcare provider. This one is tricky, and this is a priority question. So you want to think priority. Sometimes there are going to be some things that you're going to do all of them, but what is going to be the first thing you're wanting to do? And this is a safety and priority question, okay? So you can read that again, and I'll read out the options. A, document client reports of drowsiness. B, maintain the bed in the lowest position. C, instruct the client in the use of the call light. D, report client response to medication to the healthcare provider. So I'm just waiting to see some other options come in, but guess it is keep the bed in the lowest position. Safety first. Yeah, you do want to instruct them to how to use the call light, but you want to, again, we safety first. So we're going to think what's the first safety thing we would do.
Okay. Bed in the lowest position. That one was, remind me, was it C or D?
I feel like I
I
saw Jasmine again in that.
That's what I thought too, but I just wanted to make sure.
Baby doll said you keep skipping me.
Oh, hold on, let me go up. You guys have to remember too, on these lives it's hard because it goes by your Wi-Fi. So if it sometimes you might look first on your end, but you might not be first to the whole chat.
Yeah.
Okay. I see you got it, baby doll. You got it right.
Look, we gonna do better. Sorry about that.
It's this technology. It's just
Girl.
but you did get it right. I'm not skipping you. You good.
Okay, so we're gonna go on to the next one, okay?
All right. Okay. Your patient is being discharged and the doctor has placed an order to discontinue the IV. Which of the following items will you use to help you discontinue the IV? A, betadine solution. B, sterile gloves. C, 2x2 gauze dressing. Or D, tourniquet. What will you use to discontinue the IV? I see Shayla Glover. Let me just see the rest of y'all, make sure the rest of y'all get it. Yep. So you're going to use a 2x2 gauze dressing. You don't need sterile gloves to remove an IV. Yank that thing out.
I don't know, honey. Our nursing student brains, we'd be like, oh my God, do I need the sterile gloves?
You will get questions like that too on the NCLEX, guys. So just make sure you know clean technique, aseptic technique, sterile, because they will try to trip you up and give you something like that. And you'll think, oh, safety, I'm going to pick sterile to be safe.
Yeah.
No, you don't know it.
Okay, so we're going to go to the next one. I'm sorry, but Shay, did you catch that before I move forward?
You good.
Okay. Which should be included in a change of shift report?
Oh, I like this one.
I did too. A, describing routine tasks performed. B, describing basic steps of a procedure. C, reviewing information about each client. D, describing objective measurements or observations about a client's condition. Which should be included in a change of shift report? A, describing routine tasks performed. B, describing basic steps of a procedure. C, reviewing all information about each client. Or D, describing objective measurements or observations about each client's condition. So it's describing objective measurements or observation about a client's condition. So it's D.
That one's a good one too. So anything, I always tell my new nurses, anything we can look up in the computer, you don't need. You need, if something were to happen to your patient, the minute you walk on that floor, you need to know what you need to know for that moment.
And we don't have time to be explaining how you have to do something on a change of shift report, like a whole procedure. However, we don't mind sharing information on showing you how to do something. But for each patient, each task, or each procedure, that's kind of like training you again,
You got it.
Okay. We're going to move on to the next one. Oh, okay. So, y'all, this is another riddle. I'm stretching and come in different colors. I like to squeeze and be looped. I'm used to prevent blood flow. What am I?
Okay. I see Jasmine again, but let me just wait.
Jasmine lit. Yes, it's a tourniquet.
Nope, tourniquet.
It was that prevent blood flow that gave it away. That was a good one.
All right.
Okay.
That was a good one.
We're going to go to the next one.
Okay. I like this question. If your patient's blood type is AB positive, what are they considered? Are they A, the universal donor, or B, the universal receiver? If your patient is AB positive. Oh, y'all fast. Hold up.
Let's see.
Okay, yes. So if your patient is AB positive, they are the universal receiver. They can receive A, they can receive B, they can receive AB, and they can receive O. So that one is going to go to Jasmine. Brittany, I see you answered first, but I think maybe you were typing fast and you just put universal.
She said, wait, I'm going to get it.
She's like, I got it, but I think yeah. So that one will go to Jasmine B. right.
All right, Shay.
Right.
So this is you. This is another riddle.
Okay. So I'm flexible but particular. You will know me by color and size. Use me for emergencies or even basic needs. Food, water, but no air. What am I? What am I? Flexible but particular. Oh, I see it. I see it. CTX, IV catheter. Yep, you got it.
I like that one.
Food, water, but no air.
Right.
I'll put no air in that
No
IV.
bubbles in the lines. Okay.
All right.
Okay, so this is another riddle. Use me in case of immediate help. Place me where I'm easily accessible. I should come fully loaded and equipped. I can sometimes save your life. What am I?
Immediate help. Easily accessible.
It's to save the life for me.
I know that's right. Oh, I think, yep, somebody did get it.
It's the
CTX.
crash cart, yes.
I don't know your name. I'm sorry, but you got it. Jasmine was. Oh, do I, no, I gotta go by with the answer because I'm like AED is close, but that's technically not on the crash card. Yeah, so I gotta give it to CTX.
But that was a good one though. So AED could have, you know, it can save your life. But that was a good one.
Yep.
Okay. We're gonna move forward with the next question. Shay, did you get that? I'm sorry.
Yep, I got it.
Okay. The nurse should plan to obtain the device, device for a client whose legs are paralyzed as a result of a spinal cord injury. All right. Here are the options. Wait, the comments. Somebody said I'm gonna need to study more.
No, don't feel bad, y'all, because like I was answering some of these questions like, whoa, like I need to go back and study more too. So don't. That's why we here. This is all fun and just a refresher.
Yes. All right. So it's A, walker. B, slider board. C, raised toilet seat. D, adaptive eating utensil. A, walker. B, slider board. C, raised toilet seat. Or D, adaptive eating utensil. So it is the sliding board, or the slider board, which is B. So let's see. I'm not sure about that first, but okay.
Who you got for that one? I see Jasmine again. I just want to make sure. That's okay, Brittany.
All right, we're going into another riddle.
Okay. If you're fractured, I can support you, or if you're bedbound, I'm your best friend. I'm your convenience. Use me anytime. What am I? I see it.
I was gonna say I wanted to look at some more, see what everybody else had to say.
I'm curious too. That's why I'm like, I see it, but I'm not gonna say anything yet. I'm just. Anybody have any more guests? I see it though. I'm just curious what you guys think. No, Lynn, we're not skipping you. It's just whoever we see that goes first. I was explaining to them earlier, it's tough because your Wi-Fi, it might look like you answer first, but it times everybody by how the answers come in first.
Somebody said if you're bedbound, the bed is your best friend. Where else you going? Right. Okay.
Nope, you got it. It's baby. All right.
Okay, Shay, this is you. We're going into another NCLEX style question.
Okay, so the nurse is monitoring a surgical site for signs and symptoms of infection. Which finding is considered normal in post surgical sites? So, A, red hard skin, B, serous drainage, C, warm and tender skin, D, purulent drainage. Which one is considered normal in post surgical sites? So look for your keywords. I'll give you a few minutes and then I'll read it again. Oh. Okay, so I see the answer in the chat. It is serous drainage. So you should expect some drainage from a surgical site. And I see that one is Jasmine B. Good
Are we
job.
going too fast with the options, y'all? Somebody was wanting us to say it again. Okay. But somebody got that one. So we're going to move on with the next one. Okay. So the nurse is caring for an older client who is complaining of chronic pain. Which action should the nurse take first? First in the plan of care of this client. A, identify the pattern of pain. B, provide preferred pain relief measures. C, administer prescribed pain medication. Or D, evaluate the effects of pain reducing measures. So A, identify the pattern of pain. B, provide preferred pain relief measures. C, administer prescribed pain medication. Or D, evaluate the effects of the pain reducing measures. Always says period.
Period. Nelly Nell.
Yes. So yeah, you're gonna identify the pattern of pain, which is assessing. And I seen somebody say it. It was, is it Nelly?
Yep, I
Nelly?
to Nelly Nell. I hope I'm saying it right. always assessed first.
Okay.
Okay. Wait for the options before y'all answer this one. You think your patient is dehydrated. How would you test for skin turgor? A, rub the skin and look for a discoloration or bruising. B, pinch the skin and assess its ability to return to normal. C, put antibiotic ointment on the skin. Or D, ask the doctor to order a sterile technique for this procedure. How would you test for skin turgor? Oh, yeah. Good job, everybody. Yep, so pinching that skin up. That's skin turgor test for dehydration.
Okay.
All right, CTX, you got that one.
Okay, we're gonna move forward with the next one. All right. The nurse is reinforcing instructions to a client who has poison ivy on measures to relieve the associated discomforts. The nurse must most importantly instructs the client to do what? A. Apply cool, wet compression. B. Seek a prescription for antibiotics. C. Cleanse the skin with mixture of alcohol and water. D. Submerge the affected area in a diluted betadine solution. Not to itch. A. Apply cool, wet compression. B. Seek a prescription for antibiotics. C. Cleanse the skin with a mixture of alcohol and water. D. Submerge the affected area in diluted betadine solution.
Poison ivy.
Yes, so you want to apply cool, wet compression. I wonder how many people are there throwing alcohol on.
When you said that, I was like, oh my gosh. But you know how it is. Like, I even know, like, when I was younger, it don't matter what it is. I don't even want to say it's cultural. It's just general. Alcohol, yeah. Everything. If anything's open on the skin, throw
just
alcohol.
Throw some alcohol on it.
But
yeah.
You'll be screaming with the poison ivy.
So I think.
Where the Benadryl at? For real.
Right. Exactly. That wasn't an option, but that would have been a good one too.
All right, so I see CTX again, got that one. We got some people coming in and taking over.
Y'all, we're on our last one. Okay, Shay.
All right, guys. So the last question. Your patient has a trach and you must suction him. What is the limit or the max amount of time of suctioning in each suction pass? A, 2 minutes. B, 10 minutes. C, 10 seconds. D, 15 seconds. What is the max time of suctioning in each pass? When you put the suction in, how long? And take it out. I'll give you a couple more minutes to the answers.
Say the options again.
So A is 2 minutes. B is 10 minutes. C is 10 seconds. And D is 15 seconds.
Somebody said total between suction, 2 minutes total time each pass, 10 seconds, 2 pass per second.
Somebody caught on to my trick.
Yeah.
Yeah, who did that? You can't put my trick in the chat. So this question was big on keywords. So suction pass, the answer would be C, 10 seconds. And as CTX said, the total between suction is 2 minutes total time in between, but it's 10 seconds in a suction pass.
Yes.
I had to throw one.
Okay, first off, I need to go break this down for you guys. You're not going to trick me.
But that's really how those questions be.
Yeah, you're going to kill the client in 10 minutes.
Yeah, you can't suction for 10 minutes, guys. It is a tricky question, but I didn't put it there to be tricky, but these are literally some of the questions you will get. So the wording of your questions is very important for test taking and nursing.
And always look for those keywords. Okay. I really enjoyed this. This concludes our Nurse Trivia Tuesday. But before we end the live, Shay, did you come up with the score? We were taking score.
Hold up, I was so excited about that one. Let me see who got the last one. All right, let's see. Let me hide my face real quick.
Shay got to go add up her score, y'all. This was fun. So we'll be doing Nurse Trivia Tuesday once a month. Honestly, I'm not sure exactly which Tuesday of the month that I will decide to do it, but y'all look forward to the Nurse Trivia Tuesdays. And if there's anything different that y'all think that I should incorporate with the Nurse Trivia Tuesday, don't be afraid to comment or let me know if you have any suggestions. Yes, lots of fun. This was nice. It was. I appreciate you guys. Thank you. I am currently in critical care nursing. Any advice on studying? Any advice on studying? Honestly, I know we all have our different, like the way that I study, I go by off, I pull out what I feel is important for the test. Lord forgive me for telling y'all this, but no, I never review everything in the book because that's just impossible. It's just too much out there to try to obtain and learn in such a short period of time. So honestly, I pull out the things that I feel is important to pass the test at that moment, and then I will go back and review everything, like go more in depth with everything. So that's my study tip, and that's with all of nursing. I just got accepted to the LPN. Congratulations. I see you. Yes, Chris, I remember you.
Ooh,
Chris is I see you, RN. Shay, someone was asking about study tips, and I told them I usually go in depth after, but when it's crunch time, I pull out the most important things at that moment, to pass the test, because there's just no way that you can read the entire chapters and everything that's in the book. It's just too much. So that was my tip to study. Just pull out the most important things, highlight that, and then do your review to study. And then you can go back and do your studies. So what is your tip on that, Shay?
I agree with that. You're going to get a lot of fluff in your textbook, but there is certain things that are content heavy that you need. The first thing I always tell people to do is to look at the objectives of the chapter that you're going through. And if you can answer them, most of the time you can get around the questions. Critical care nursing, the biggest fields in critical care are cardio and pulmonary. So make sure you really get in depth with those systems. You need to understand the anatomy and physiology to answer those questions. So you might have to go back and refresh yourself, but don't, like I said, don't grab every single thing your textbook has. As T said, it's very like there's certain concepts that you'll need to understand. But if you're able to go back to your basics with anatomy and physiology, it'll help you answer those questions like nothing.
Yes. Yes, dosage questions would be good. Or medications. Okay, I'll try to incorporate that next time.
Y'all challenging me. Those
system.
struggle.
What was that, Shay?
Good. That's a good idea for a trivia.
Yeah.
That's where a lot of people have problems with.
Any workbook recommendations? Any workbook? I love ATI, however, they do not have critical care ATI.
Yeah, but so critical care, just try to focus on pulmonary, cardio, neuro, those systems, and focus on like emergent things that would happen in those sections too. Those will really help you with your studying for that. Y'all know, if any of you guys don't follow me or haven't seen me, my Bible when I was in nursing school was Saunders. In fact,
yes, Saunders was live, and Saunders PN is what I use strictly to study for NCLEX, nothing else.
and there's probably a new edition because y'all know I graduated in 17. But this is a really good book, and it really takes out the fluff of your textbook and makes sure you have the concepts that are most important.
In addition to that, they also have the Saunders NCLEX flashcards, which I use for the live. And what I love mostly about these flashcards is on the back that they actually break down the rationales for each question. So if you guys don't know anything about that, you can, I'm sure you can find it on Amazon, but I got mine from Barnes & Noble. It's the NCLEX Saunders flashcards. Brittany used Saunders too. Yeah. Okay, Shay, who was the winner?
Okay. So third place goes to CTX. I'm sorry, I don't know your name, but that's your YouTube name. So congratulations. You came in late, but you came in strong. Second place goes to Brittany. And our first place winner is Jasmine B.
So Jasmine was on it. She's
guys. But you all did
y'all
good.
all did so good though.
Everybody,
like, look at them nurses.
Okay.
Chris said next time he coming on time and he gonna win. Okay, y'all. I really appreciate each and every one of you. Thank you for being a part of this live. And Shay, thank you for being my co-host. You're so much fun.
Oh, no problem. Thank you for inviting me. This is really fun. I had a good time.
I did too. So, guys, I guess I'll see you in the next Nurse Trivia Tuesday. So, y'all have a good night, okay? Bye.
Good night.